Hello, how are you, everyone? Welcome again to today's iCON forum, our online webinar, Take Charge of Your Health, Living Well Together with Diabetes. I am Barbara Ho. I am the Chief Nursing Officer of iCON Chinese Division and your host today. Today's topic, the theme, again, has to do with diabetes. iCON is, the office is situated on the traditional, ancestral, and unceded territory of the Musqueam, Squamish, and Tsleil-Waututh peoples. We would also like to acknowledge that you are joining us today from many places, near and far, and acknowledge the traditional owners and caretakers of those lands. iCON is an initiative of the UBC Faculty of Medicine. Let's start with Digital Emergency Medicine Initiative. The main purposes are through organizing health seminars, workshops, and using web technology, we can help multicultural the public to know more about prevention of diseases, and also for those who we can instill knowledge for using digital technology to manage your chronic diseases. We hope that we can give you accurate and reliable information for everyone to share. We hope that not only local public can share with this, we hope that through the webinars, we can also spread the knowledge to far and remote places so that everyone can strive to improve our physical health.
So earlier on, Dr. Leong has already touched on some medication, but because diabetes patients many a time would, when they are confirmed that there's a chronic disease they have to face, they have to be prescribed medication or even insulin. And today we are very glad to have Glenn. I say our because Kent has been working with iCON for so many years, numerous times regarding medication management. So we have Kent today again, and we will look at proper medication management in regard to diabetes. So I'll pass the time to you, Kent. Oh, hello, everyone. So it's me again. So I'm Kent Ling. I've worked with online for many years. And today I would like to talk about medication management regarding diabetes. So I will also share other information with you. So the first thing, the purpose today is to understand the importance of following medical treatments and the important proper use of oral medication and insulin injection. And the next one is to learn about Pharmacare coverage in relation to diabetic supplies. And also we try to understand how to prepare. And then, so also the cost of medical supply for diabetes, because we have to keep testing our blood sugar level, so we have to understand. And also, well, one of those days when we have a sick day, then how can we prepare ourselves to manage a sick day? So these are the things I'm going to talk about. So the first thing is, the most important thing, the goal for treating diabetes is there is no cure of diabetes, but the most important goal is to control it. So to maintain your sugar level at a normal level, and then so that you can maintain your glycemic control level. And then if it can be maintained at a normal level, then you are no different than a person who does not have diabetes. And then we also have to prevent or minimize the risk of acute or chronic complications, just like Dr. Liang has said. So if you can if you do not control it properly, there will be a lot of complications like infection of the feet and other infections. And also our goal is to control and prevent other risk factors such as hypertension, obesity, or dyslipidemia, because these conditions can also lead to other complications. So for people who are having diabetes, if you could control these, then you could further avoid complications or other risky diseases. So Dr. Liang has already talked about medications. There are many different ones. They can be taken orally or by injection, and some injections can be insulin or even non-insulin. And there are two main types. The first type is type 1 diabetes, and the second one is type 2 diabetes. And sometimes for pregnant women, gestational diabetes. So usually we focus on type 1 and type 2 diabetes. For type 1 diabetes, very briefly, because of the cells in the pancreas have failed. They cannot produce insulin at all. So for type 1 diabetes patients, they have to receive injections of insulins because the pancreas does not produce any. So for that, there will be rapid-acting insulin, and some will be short-acting, and some will be intermediate-acting, and some is long-acting. So for the doctors or the certified diabetes educators like pharmacist or specialist in diabetes, they would, according to different situation individually, prescribe different types of acting, because your lifestyle can be different and the diet may be even different, and the amount you eat may be different. So there would not be a set dosage. So it will be prescribed specifically to the individuals, because if you have too much insulin, then it will cause low blood sugar. If it's not enough, then it cannot control the blood sugar. So everyone is different. Now, for type 2 diabetes. For type 2 diabetes, because the pancreas is not totally failing, so in certain extent, the pancreas is still secreting insulin, but you may have to rely on some medication. One common one is metformin. And there would be glyburide, glycoside. And the second type of the glyburide or glycoside, well, if you have too much of that, it will cause low blood sugar. And therefore, controlling the dosage is very important. For injections besides insulin, there will be Ozempic, just like Dr. Liang has mentioned. And there are many injectables. They are much newer, and then they are a little bit more expensive. And there are other oral more different types, like pioglitazone or rosiglitazone. So you may say, so many different oral medications, which is better? So I can tell you that actually every medication is a benefit and its shortcomings. And for one medication that's good for one patient may not necessarily be suitable for you. And therefore, your healthcare provider team will determine on your personal situation to choose the best choice for you. And therefore, you have to understand using medication to treat diabetes is to control blood sugar, to control it as closely to the normal level as best we can. And therefore, it's impossible to treat it completely. And also, we would like to prevent complications. Some people don't like medications, so they would try to cut the dosage. They're just worried, oh, these Western medication will cause a lot of side effects. However, if you do not use the correct dosage and have the desired effect, then there may be complications. Because once when complications come up, it may be a little bit too late. So therefore, it is very important to follow the doctor's directions and then follow the label on the bottles, and don't just change the dosage yourself. Otherwise, if you may fail to control your blood sugars and increase the risk of having complications. So different medications, we have talked about different ones, the metformin, glycoside. So actually, what is the mechanism of them to work in the body? So of course, the major goal is to control the blood sugar, but their mechanisms can be different. So as I said, one medication which is good for a person then may not apply to you in your case. And also the doctor may also look at other health conditions that you have, because if you have other health conditions, some diabetes medications have to be avoided. Of course, there will be side effects. So unless your body cannot withstand the side effects, otherwise you should be following the doctor's direction and then following the label of the medication. So don't say, I would like to avoid the side effects and then I avoid the medications. So that is not the right thing to do. Every time when you fill up a prescription, we'll let you know about the side effects. But even after you have heard about this, don't worry too much. So this is our obligation to tell you, but they may not really apply to you. But this is our duty to do so. We are not to scare you. And this is only something that is possible, but not necessarily probable. So even when they do come up, and then if it is too unbearable, then talk to the doctor to see whether you have to stop that. So this is one thing you have to avoid. Do not stop the times of dosage. For example, if the doctor tells you to take it 2 times and you cut it in 1, and then you are telling yourself, oh, today I feel good, so maybe I can cut my medication, because sometimes you may not have any symptoms when you have diabetes. Usually, if you have low blood sugars, you may feel it. But if you have high blood sugar, you may not know, only when you are testing your sugars. And there is a poll question for you. So I would like to see what you think about it. So what if you forgot to take your previous dose of medication? What do you do? Let's say in the morning, you have forgotten the morning dose, and now it's afternoon. So what will you do? I've got 3 choices for you. A, take the forgotten dose immediately, even if it is close the time to take the next dose. That means, oh, I forgot the morning dose, I'll take the 2 doses together. And B, will be just skip the dose completely. I'll just take the afternoon dose. And C will be depending on the medication you're taking and the blood sugar level at that time on whether to take that extra forgotten dose. So please give your answer. So is it A, B, or C? Oh, yes. The answer is no. Of course, it is C, because you have to depend on the medication and your blood sugar level. Why is it? Well, diabetes is very characteristic, has its own characteristics. Let us look. Oh, answers. So roughly 30% for every answer, but actually the correct one would be C. So for diabetes, is quite different from other diseases. It depends on the current blood sugar you are at. So let's say if you have forgotten, and then you first of all try to examine your own your body. Do you have any unusual symptoms? Then if you don't, then give yourself a poke. Test your blood sugar. If everything is normal, then well, it's easy. Just take life as normal, and even if you have forgotten one, it's okay. Your blood sugar level is normal. However, now when you test your blood sugar, it is very high, and then you should have had your insulin, then you should give yourself an injection right away, or even change the dosage. Then you usually should ask your doctor, so should I have a different dosage if my blood sugar is very high? So diabetes management is a little bit different from the management of other diseases. It depends on your physical condition and your blood sugar at the moment. And therefore, the answer is C. And if you're still not sure how much I should take, whether I should skip, so I think you should go to your pharmacist or to talk about this with your doctor. And many people, as said, would inject insulin because oral medication may no longer manage and control the blood sugar. So for injections, so there are a few things we have to pay attention to. So injecting insulin, now we use, we call it injectable, or we call it the pen. So look at this, what I'm holding up. So a pen, so it looks, yeah, they come in the form of pens. So before you have to assemble the pen, and then you have to use the insulin, and then you have to assemble the needle, you have to screw it on. So when you're injecting that, making sure that all the injection dosage, making sure it is accordingly to the label, because if you inject too much or too little, then it will affect your blood sugar. If it is too high or too low, there may be risks. So how do we check? Look at the pen I have. So at the end of it, there is a number. So if you dial it, so check it 2 times, making sure if you're dialing, if you should be injecting 38, make sure you do, and then leave it to 38. And then don't just casually change it to a number, and then once when you have it injected, then you cannot extract it from your body. So before you give yourself the injection, make sure that you check very carefully. And also do not repeat the use of the fingertip of the needle or the needle. So this is one of the needles. They are supposed to be used only once. Now you can see, you have to open it, and you can see there is a needle inside. So don't open it yet. So this needle is just right to be assembled into the insulin pen. And you can see it will punch a hole, and it can connect to the insulin. And after dialing the desired unit, then you open the cap, and then you can inject it into your fatty part of the body, holding for 15 seconds or so to making sure that the insulin has gone into your body. If you keep repeating using the same needle, what would happen? So if you keep doing this, then this needle may bend. So what if it's bent? The insulin in that case may not be able to go through the needle and go through into your body. So don't just think of costing money. I know. So a box of needles can be $40 or $50, but don't repeat using the needle. If you keep screwing that on, if the needle becomes bent, then it cannot lead the insulin into the needle head and the needle point. And then if you keep using that, that means repeating the contact of this point into your fatty tissues, then the needle is not as sharp, and you will feel pain and increasing the risk of infection. And do not inject in the same site. If you do so, you are stimulating your fatty tissue, and a lump may be formed. and there will be the blockage of the lymph nodes, and you would find a lump there. It seems that the skin is getting thick, and if you keep repeating in the same area, it will reduce the absorption of that medication, and also it is not good to the skin and increase the risk of infection. So please remember this. Now, I'm talking about testing of your sugar. So traditional ways will be using these test strips. So a bottle like this, usually there are 100 in one bottle. And usually when we buy one bottle of these test strips, the blood glucose machine will be free. If you buy it from one company, then they will give a machine free of charge. So you just take it out, and then you take your machine, you put the strip into your machine. Immediately, the machine turns on automatically. So wait for about 5 seconds. Then it will prompt you to put some blood. And then you have the machine comes with a device to poke your finger. Usually not much blood is required. A very small amount of blood is enough to test your sugar. So this needle, so this one again, you should not be reused because this will increase the risk of infection. And then after you have inserted the needle, pull it back, and then just like pulling the trigger, and then you can poke your finger. And it's a very slight poke with 1 drop of blood coming out. And so you can put it close to the machine, and it will the test strip will take up the drop of blood, and then in a few seconds, the blood sugar level will be indicated. So this is really simple, and you don't have to be very, very complicated. And there are many different machines. It can be connected to your smartphone. It can be connected to your computer. But if you say, oh, I'm not very familiar with a smartphone or computer, so some very basic function blood glucose machine would take care of your blood testing very effectively. So this is the most traditional one. So in the past few years, then we have something called the continuous glucose monitor. And this is a very interesting product. It can tell you the blood sugar minute by minute. So currently we have 2 brands. One is Freestyle Libby, and the second one is Dexcom. So actually they are called the continuous glucose monitor. So you can know your blood sugar any time of the day, and there is no poking of your finger. And there is usually a sensor, which is a monitor, a device for monitoring. Usually we put it behind the upper arm. It is there all the time. So how is it done? There is a very small needle, not too sharp. I tried it on myself. And then when you put it on, it doesn't cause pain. But once when you have done it, it's stuck. It sticks into your body. So as long as for 14 days, even when you're showering, it stays on. And you can tell your smartphone, and that there is a device, you can buy it separately, and you can immediately see your blood sugar at that moment of time. This is really helpful to patients with type 1 diabetes because they have to know their blood sugar minute by minute because their cells in the pancreas have failed them. So they have to control the blood sugar very precisely. So the traditional strips are on the market. So for $100 bottle, so is around $75 or $85. So when I prepared this slide, that was the amount, but maybe now it is a bit more expensive, maybe reaching $90. And there are 100 strips. And blood glucose monitor is free. This is the most traditional one. And earlier on, I said the continuous glucose monitor. And as I said, every 2 weeks, you have to change the sensor. And the price is from 100 to 120. Yes, it's a bit more expensive, but remember, you can tell your blood sugar anytime, right, without having to poke. And between the two, they for the Desicom, maybe $345 a month, and then change every 10 days. And you have to buy a transmitter. So if you work it out, so they are pretty much close in regard to pricing. But if you would like to have it covered by the government so that you can be covered using the continuous glucose monitor, the government is covering the second one, the Desicom G6. Now we are talking about something more practical, about money, okay? So how much is the government paying? So actually the government is taking care of diabetes patients, but well, we can just buy any strips or any continuous glucose monitor? No, yeah, there will be an annual limit. So how do we decide on the annual limit? Depending on your diabetes situation, and also the way of oral medication. So depending on the treatment, for example, if you're using insulin, but you do not use a continuous glucose monitor. So, so maybe type 1 or type 2 diabetes, and then every year, there will be 3,000 test strips, 3,000 test strips. So if you work it out, then 136 days, then it will be, so let me see. So every day you can test about 5 times because for people doing insulin, it is already a further advancing stage in the diabetes, and therefore the government allows more testing every day. For people who are using a continuous glucose monitor together with insulin, then the government I'm talking about test strip, okay? So annual limit will be 200. So how come it's 200? Because you're already using a CGM. You can have continuous information about your blood sugar and you do not require the 200. But why does the government still allows 200? Because sometimes, you know, when you don't wear the monitor properly, or sometimes there may be technical issues, then you can still go back to the test strips for your blood sugars. So that's why the government still allows 200 for annually. And for people who have milder diabetes, and then you have oral medication, and well, you have a hypoglycemia. That means what does it mean? For example, you have glycoside, this kind of medication. These medications cause hypoglycemia more often. And for these kinds of patients, the annual limit is 400. So the next one. Now for patients taking oral medication together with a low risk of hypoglycemia, for example, you're not using glyburide or glycoside, and the government only allows the annual limit of 200 test strips. So for people who actually don't rely on medication, they will control their diabetes by a diet or lifestyle, then the government would have an annual limit of 200 that will be covered. But you have to understand that if the government is covering such test strips, however, it only when you are diagnosed by the doctor that you have diabetes. So when and how can I be receiving these free covered test strips? So you have to go to education class, and then you have a certificate, then you are approved to be covered by this annual limits. So for these CGM, the continuous glucose monitor, it can be covered by the government. You don't have to attend classes. You can apply for authorization, but only through the doctor. So when the doctor says that this is the thing that is suitable for you, the doctor can write to ask for authorization. And usually for the beginning, authorization is for 1 year. And after that, it can be repeated every 5 years. However, it would be you are willing to follow, but to be followed by the healthcare team of diabetes. And some people may say sometimes we may have a cold, we may have a flu, or unfortunately you have COVID, or maybe stomach upset. So your lifestyle that day will be different. You may not be able to eat as much, and therefore the amount of insulin or oral medication may be different. And in that case, how are we going to prepare for that? So when you get sick, you have to pay extra attention to your blood sugar. You may have to test more often because once when we are sick, we may have more hormones and then changing the blood sugar level. So don't just stop the medication you've been having. The best thing is to ask your pharmacist. And the most important thing is to look at your blood sugar levels. And of course, if you check your blood sugar every 4 hours, that will be even better. So have more water so that you will not have dehydration. I know, yeah, it's easy when I say it, but I keep saying, keep a close monitor of your blood sugars. For the time being, you might have to stop certain medication, but that has to be under the advice of your doctor. And of course, in order to prevent for a sick day, to receive all the immunization and then see the doctor when required. So this is all I have for today. Okay, thank you, Kent. This is a lot of things to learn about having medications, especially for diabetes patients, especially if they have hypertension or other health conditions. Then there are too many medications to deal with. So for some people, they may even have Chinese herbal medication, and that would add on to the complication. So yes, I think the best thing to do is to share with your doctor, your nurse, and the pharmacist, and then don't keep it to yourself and then secretly pick on some secret prescription or some secret formula. Although we do receive a lot of training of the Western medication, so we don't know too much about the herbal medication. So we have to ask herbalists, and to avoid a conflict in medications. Thank you, Kent.
So if you are taking part for the first time, you have not been registered in our email list, you can scan this QR code to join our iCON mailing list. And in future, whatever activities we have, we will let you know in the first instance. I want to thank our community partners who are, well, there are very many, you can see. They are Vancouver Coastal Health, Fraser Coastal Health, CMHA, and South Vancouver Neighborhood House, Richmond Cares, Family Caregivers BC, UVic, Self-Management BC Institute on Aging and Lifelong Health, Vancouver Divisions of Family Practice, and Vancouver Public Library, as well as Villa Cathay Care Home and Richmond Care, Richmond Gives Caregiver Hub, Mosaic Caregiver BC. Thank you to all of you to help us promote and advertise this program to the public out there. And I also want to thank our media partners. They include Fairchild TV, Omni TV, Ming Pao Daily News, and as well as Singtao Daily Group. And I also want to thank over the last 2 days, the hubs that were open have been open to the public. They include CRC Health Center, Jackson Lamb Adult Daycare Center, Day Center, South Vancouver's Neighborhood House and Villa Cafe Media Partners. Those are our media partners. You want to watch those presentations again, as well as other presentations, you can go to our www.iconproject.org website, as well as icon.support@ubc.ca to review those presentations.